And can you introduce yourself today, your name and what you do at the clinic?
Sure. My name is Michael Barnes. I'm the longest serving board member at the Community Free Clinic. I've been on the board now for 17 years, and I have served either as a board member, president, or vice president during those last 17 years, and currently serving as vice president.
Awesome. That's great. And when did you start working with the clinic? Was it as a volunteer, just a donor?
Actually, I started on the board, and it was probably spring of 2003.
Awesome. And did you interact before you were a board member? Like, did you donate to the clinic or volunteer with us?
Actually, I started as a patient.
Very cool.
I had just started a business and I couldn't afford insurance. And at that time, I was very unhealthy. I was overweight. I was taking 15 medications a day. And I couldn't afford health insurance. So I started getting my health insurance or my health care through the Community Free Clinic.
That's awesome. And why did you want to become involved with the clinic?
Well, after the care I received, I felt what a better way to give back to somebody that helped me during a difficult time was than to become active with the board.
Awesome. And what is your favorite event the clinic has done? Either something ongoing or something that they did as a one-off in the past?
There's so many of them, so many that I participate in, and I think probably the funnest one is mud volleyball, which we absolutely missed this year.
You're a board member, but are there any like patients or stories from patients that have made like an impact on you that you might have heard?
I've just heard throughout, the care that they receive that from patients, feedback from patients, and all that. Just because they're using a free service, they were still made to feel human, and I just love the compassion that the clinic staff shows to our patients, and quite honestly, the staff is just like a big family.
Very good. Why should someone in the county care about the community free clinic that maybe has a job, already has insurance?
Why? Because we are open for the county, not just for city residents, and our services are for those that are underinsured or have no insurance. So, yeah, the county, people in the county, please come in and use our services.
And again, if you don't like it, I can edit this one out too. Why should someone from outside the county, someone from the greater Maryland or someone that might just see this online, why should they care about the community free clinic?
Well, actually, I think why they should, if other counties could come in and do a tour and see how we can treat a patient all year, the model that's second to none. Our healthcare is second to none, and actually, it would be great if the federal government came in and see how efficiently we can run healthcare.
So very good. And just because it is for Washington County Gives, is there another organization or nonprofit in Washington County that's kind of close to your heart that you'd like to give a shout out to or anything today?
Absolutely. 2 years ago, on September the 10th, I lost my mom, and I have donated in the past, and when I can, to Hospice of Washington County. What a fantastic organization, and those are us and them are the two biggest favorite charities here in Washington County.
And just as a closing, what would you like to say to a potential donor for today?
Your dollar is very important to us here in Hagerstown at the free clinic. We have gotten it to where we can treat a patient for an entire year for roughly about $306. Nowhere else can you get that. A normal doctor's office visit is over $200. So it's very important that we get those funds in from donors so we can treat more people.
Great.